Academics like Professor Derek Crook and Sir John Bell from Oxford and Professor Aradazai from Imperial, Deloitte and Boots, who've delivered our drive-through centres, AstraZeneca, GSK, Novocyte, whose labs go on stream next week, Public Health England and the NHS, of course, who've pulled out all the stops, Professor Sharon Peacock, Professor John Newton, and the UK Biocentre and the CRIC, who set up high-tech laboratories. And also, it wasn't just a national effort. People from across the world, including Thermo Fisher, Hologic, Abbott, and Amazon from the US, QIAGEN from Germany, and Roche from Switzerland. And this is how we did it, because everybody worked together with grit and determination to reach a shared goal. And they thrived because the team contained diversity of perspectives, of backgrounds, and critically, a diversity of thought. And when things went wrong, which they did every single day, believe me, we didn't ask who we could blame. We asked how we could fix it. So to my team, I want to say you toiled tirelessly, night and day, and I'm so proud of what you have achieved. And to all of you, on behalf of government, on behalf of the whole country, thank you. As the Prime Minister said, a big increase in testing provides a way to unlock the puzzle of coronavirus. And testing forms the first element of our plan to test, track and trace. By mid-May, we'll have an initial 18,000 contact tracers in place. That work is underway as we speak, and if it needs to be bigger, we'll scale it as required. The combination of contact tracers and new technology through our new COVID-19 NHS app will help tell us where the virus is spreading and help everyone to control new infections. People will be able to know if they've been in close contact with someone who's transmitting the disease and take the action that they need to. Our full-scale test, track and trace model will drive the infection rate down, and the lower the R and the lower number of new infections, the more effective the track and trace system will be. Tracking and tracing will allow us to get R down and hold R down. And so it will allow us to lift lockdown measures. Now, this disease affects us all indiscriminately. We've seen that. In recent weeks, we've had to impinge on historic liberties to protect our NHS and our loved ones. And yet our goal must be freedom. Freedom from the virus, yes, and we will not lift measures until it is safe to do so. But also, we care about the restoration of social freedom and economic freedom too. Each citizen's right to do as they please. For now, we're working together to stay home. We're impinging on the freedom of all for the safety of all. With this next mission of test, track and trace, I'm seeking a solution that allows us, by each of us participating, to target the measures that are needed with much more precision. And so to reassert, as much as is safely possible, the liberty of us all. That is our next mission. But for now, the most important thing for everyone to do, to keep R down and to get us all through this, is to maintain the spirit and the resolve that's had such an impact thus far. So please, stay at home, protect the NHS, and save lives. And now Professor Newton is going to set out some more details on testing, and then I'm going to ask Professor Powis to set out and take us through the slides.
Thank you very much, Secretary of State.